Mishriky. I am a registered nurse and I work at Hartford Hospital in Hartford, Connecticut. I currently work in the outpatient post-anesthesia care unit, also known as the PACU, at the hospital. My job entails taking care of patients after they come out of surgery. So we manage taking care of their pain, making sure they don't go home with an upset stomach, and getting them ready for everything that they need to be discharged home with their families. So I chose nursing because I really like taking care of patients. It's really nice to take care of people in their time of need. I also love learning about all the different medical procedures. Where I work at, we do all different types of surgeries, and it's really neat to see all the new things that they come up with, and it's pretty amazing what they can do for the human body. In order to become a registered nurse, you need to obtain a degree of nursing. So you can go get an associate's degree in nursing, or you can get a more involved degree called a bachelor's of science in nursing. That's what most nurses get now for their nursing degree, because that is most attractive to hospitals right now. In order to prepare to become a nurse and go to nursing school, it's important to take the proper classes. Important classes to take are science-based classes, so biology, microbiology, human anatomy are all important. I also think that it's important to take a language class. We take care of all different patients, and not all of them speak English. So personally for me, I took Spanish, and it's important because I'm able to communicate in at least small sentences with my Spanish speaking patients, and that makes them feel a lot more comfortable when they come into the hospital. So a typical day as a nurse depends where you work at. Typically I work, at 7 in the morning until 3 p.m. And we are, like I said, taking care of patients in the recovery room. We also get them ready for surgery in the morning. So we go through questions with them. We might give them medications, go through their medical history with them, and talk to the doctors and anyone else that's working with the patient to make sure everyone has got everything together to take good care of them during their surgery. So you do need a few different types of skills to become a nurse. You need to be organized, you need to be detail oriented, you need to have good time management, and you really need to be good at communicating. It's really important to patients that you listen to what they have to say and that you are able to verbalize and communicate back to the patient what's going on with their care. When I was in middle school, I wasn't necessarily thinking about what I wanted to be when I grew up, but I did really enjoy medical things and watching medical TV shows, so I kind of knew that I wanted to do something in the medical field. As I got older, I realized that nursing seemed like a really good fit for me. I like taking care of people, I like talking to people, and I have good organizational skills, so it seemed like the right fit for me. My favorite thing about my job is, like I said, there's so many different things to see in the hospital. I also love that there's so many different places you can work at in the hospital. You don't have to work in the recovery room. If you like things that are more exciting, you could work in the emergency room. If you like things that are, quiet, you could go work up in the maternity unit and take care of the babies. There's so many different places you can go, and you don't have to stay in one place. You can, work in a different area throughout your whole nursing career.